So, hello everyone. So, we are studying lower limb. In previous class, we discussed about hip joint. Today, we will discuss about knee joint. Very important joint. Okay, weight bearing joints. These are weight bearing joints. Our whole body weight will particularly affect on this joint. So, that's the reason we'll able to see whoever have lot of weight, they will develop initially knee pain, okay, back pain or neck pain. Okay. So let's start the anatomy of knee joint. So basically, what type of joint is that? It is a hinge joint, or we'll call it is condylar joint. Condylar joint. Okay. This hinge type of joint. Okay. So basically, what are the bones are involved? So there are three bones or two bones, mostly three bones. You can see this is femur and tibia and patella. Tibia and patella. So these are the three bones are involved for making knee joint. So basically what we are going to study, first we study about bones, what are the bones are involved, second ligaments, some locations, important locations, what are the things are passing through knee joint, we will discuss locations and functions also, and nerve supply and blood supply, and some applied aspects we will discuss. So let's start the knee joint. So basically first bones, what are the bones are involved? You can see this is the diagram of femur bone, and this is the femur bone, and you will have tibia, large bone. It is in the medial side, lateral side, fibula. This is the fibula, lateral side. Both are. So these are the three bones. Other than that, you will able to see the patella. So this is the patella bone, which is the anterior side of the knee. So this is the femur. This is tibia and patella. Okay. So these are the bones are involved. So what are the joints areas? So you will able to see the lateral epicondyle, medial epicondyle, lateral condyle, and medial condyle. So these take of formation for the making of knee joint. In the tibial joint, you will able to see lateral condyle, okay, and it is the medial condyle. So both are involved. So they are fixed together like this, okay, like this. They will fix together. Okay. So for holding their position, you need to know the ligaments. Bones are placed at one place, but you need to have ligaments to fix the joint at one place. Okay. So they are very, very important. Ligaments, without the ligaments, the bone is unable to fix at one place. It will able to move and somehow you will able to have pain, okay, and someone have different things, and it is a synovial joint, already we studied in initially. So synovial joint, synovial membrane is there, and the synovial fluid is there, okay, very very important for the knee joint, okay, for movement to reduce the friction and weight. Okay, so let's talk about ligaments. What are the ligaments are there? First ligament is fibrous ligament, fibrous capsule, or we will call as ligament. Second, you are able to see ligamentum patellum, ligamentum patella. Okay, and third one is tibia collateral ligament, tibia collateral ligament. And you will have fourth one, fiber, yeah, or fibular collateral ligament. It is coming by fibula. So that's the reason we call fibular collateral and ligament. And fifth one is oblique popliteal ligament. It is coming from popliteal region, oblique popliteal ligament. And sixth one is we have meniscus, very important. Okay. And you have fifth one that cruciate, sixth one, and seventh one is cruciate ligament. Cruciate ligament. So these are the fixer, okay, fixer like that to move the knee joint, but uh, not get deviated from its place, or dislocate from its place. So let's see the fibrous capsule, ligamentum patella, and tibial collateral ligament, fibular collateral ligament, oblique popliteal ligament, meniscus, cruciate ligament, and one thing is available in the knee joint, it is bursa also. Bursa also. Let's see the in that image what we are shown. You can see that. Okay. First, we will talk about fibrous capsule. Okay, these are nothing but this is the bone here. You can able to see in this image. Hmm. So this is the one. Okay, this is the one. It is very important. This is called fibrous cartilage or articular cartilage also. This is the first ligament. Okay, it is both. It is having both and the tibia and femur. It is covering like this. It is covering like this, and both are having covering that synovial membrane. Okay, this articular cartilage is the layer on the femur bone and as well as tibial bone. Above that, you will able to see the synovial membrane also. Okay, this is first articular cartilage, and next one is ligamentum patellae. Okay, you can see that this is the patella. This is the ligament. We'll also call patellar tendon or patellar ligament. Okay, this is going through the here. You can able to see this is the patella. This is going on here, and it is fixing on the tibial bone. Okay, so this is also called ligamentum patella. So it is arising from the patella and it is inserted on the tibial bone. So it is also helping for movement or fixing the joint. Okay, this is the second. Third is tibial collateral ligament. You can see this is the tibial collateral ligament. You can able to see here. Lateral collateral ligament also will also call medial collateral ligament. Also name. You can arising from the tibia and it is going on the fibular bone. Okay, medial condylar ridge. Okay, this is the medial condyle. So it is arising from the tibia and going on the femur bone. So that's the reason we'll call medial or as well as tibial collateral ligament. And this is fibula because it is arising from the fibula. It is going on and it is on the femur bone. We'll call lateral coligament ligament. So this is the first, this is the second, this is the third, and this is the fourth. So we discussed four type of ligaments, and we'll be able to see the oblique popliteal ligament. Oblique popliteal ligament. I think it is here. I think it is not in the diagram. So it is arising from back side, posterior side, popliteal region. Okay. It is oblique type, like this cross from the femur will arising to the tibia like this. Okay. It is cross like. Okay. You will able to not it in the diagram. Okay. I think I will show you 1 second. So this is the oblique popliteal ligament like cross. I told you now that from is coming from the posterior side of the femur and it is inserted on the tibial area on the medial side. So it is coming from the like this, like that, because it is it will block the knee. What it will do, it will block the knee from it is going behind the uh, area. Okay, what it will do, it will block the knee. Okay, so these are the five types of ligaments what we see. Next we have oblique. Next, meniscus is there. Meniscus, there are two ends, four, six, total six meniscus are there. Okay, you can see in this image. I will show you. Okay, so these are the meniscus. These are the bursa. These are the meniscus. Yeah, these are the meniscus. Okay, so this is medial meniscus, lateral meniscus. Okay, these are the meniscus. Okay, anterior meniscus. This is anterior. This is anterior meniscus. This is inner meniscus, and this is lateral meniscus. This is medial meniscus. So total six meniscus. Okay, so why are meniscus already are they joint and we have articular cartilage? Because because knee joint is the most important joint, and in the whole life it work more than other joints. Always you have to walk, weight bearing, so it's extra safe to save the to protect the knee joint, and it will produce the shock absorber while running, high jump, okay, jumping. Okay, when these types of works you will do, you will get more protection. Okay, meniscus will do you give the right type of absorption. It will protect from the shock, and as well as it will give lubricant also. Okay, and protect the cartilage. Okay, so the protection for the cartilage and shock absorption and lubricant, we need meniscus. So very, very important. So this is completed meniscus, and you have crucial ligament. Crucial ligaments also is present in this knee. You can have see this image, very important images. Okay, all the diagram, all the everything is present in this image. So this is the posterior crucial ligament and anterior posterior ligament. So this is coming like this. This is coming like this. From the back, it is coming front anterior crucial ligament. From the posterior, it is coming here. Okay, like this image you will show very this is like this. Okay, this is anterior. This is attaching the from coming from the femur tibial bone attaching to the femur bone. From the posterior side coming from the femur bone and attaching to the knee joint, or sorry, attaching to the tibia. Okay, so this is crucial ligament, anterior and posterior. Next we have bursa. Bursa also like that, fluid filled with sac. Okay, yeah, if you have like this balloon shape, some balloon you filled with water, what how will like the small, like you will be able to pinch and you will be able to feel soft like this. These are the bursa. So these are also very important. This is for protection of the knee also. These are also for protection of the knee. So you can see these are the bursa, semi-membranous bursa, this picture posterior side. This is super patellar bursa. This is patella bone. So it is above. So there's the reason supra patellar bursa, infra patellar bursa. This is deep infra patellar bursa, subcutaneous patellar bursa, and this is lateral side. You will able to show called subsartorial bursa and subcutaneous patellar bursa. So in the patellar region, you will able to see four bursas: supra, infra. You have deep and subcutaneous, and pre-patellar bursa, and two are on the posterior side. One is lateral side. So this is also very, very important. So these are the bursa. So we studied about ligaments, all the ligaments and bursa in detail. So I shown you the area where the uh, ligaments are there, how they are attaching each other from the where the ligaments are arising. Okay, in some books I had written that these are the ligaments. Some of the ligaments are degenerative parts. Initially they are like patellar bursa. Initially they are muscles. So mostly our ancestors, they are like tall, very tall, very tall. Why that? Because these ligaments were the muscles were there, okay, long, long muscles. So gradually, age by century by century, those muscles shorten, 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 and become ligament. Okay, so these are the things. So what are the parts are arising from the anterior of the knee, posterior of the knee, and lateral side and medial side, lateral and medial. What are the things are going on? First, anterior, you will able to see the ligamentum patella only, patella bone and patella ligament. And posterior, backside, you will able to see gastrocnemius, popliteal vessel, and tibial nerve. You will able to see gastrocnemius muscle, popliteal vessel, and tibial nerve. And lateral side, biceps femoris. Lateral side, you will see biceps femoris and fibular collateral ligament. Already you studied. In the medial side, semitendinosus, semimembranous, sartorius, and gracialis. All these are uh, going on this area, medial side. Now we have blood supply. We'll have blood supply. So we have main arteries, femoral artery. Femoral artery is very, very important. One, number one, because this is the joint. So what we have anastomosis, means multiple arteries will go through and they will give their branches. Okay, likewise we studied in shoulder joint, hip joint, and all the joints. So because to if any artery damage occurs or any supply broken, so other artery will supply that area. So anastomosis are there. So what are those arteries which are making femoral artery, popliteal artery backside, femoral artery, popliteal artery, lateral. This is also femoral artery, tibial artery, anteriorly tibial artery, and tibial artery, posterior also tibial artery. Femoral artery is mostly is coming on the uh, medial side, lateral side, or medial side and lateral side. Anterior and posterior you will be able to get tibial artery, and back side posterior we have another artery, popliteal artery. So femoral artery mostly medial and lateral side. It is coming from popliteal artery, posterior, tibial artery, anterior and posterior. So likewise, one circumflex anastomosis is developed to give the circulation to all parts of the knee joint. Okay, now what is the nerve supply? Nerve supply, you have three nerves. One is femoral nerve, one is femoral nerve is sciatica nerve, sciatic nerve, and third one is obturator nerve, obturator nerve. So these are the nerves. And what are the movements? What type of movements you will do and which muscle is responsible? So we have four types of movement: flexion, okay, extension, medial rotation, and lateral rotation. For extension, one muscle is very, very important. That is quadriceps femoris. If you want to extend the leg, what you have to know? You have to get the help of quadriceps femoris. Quadriceps femoris. And second is extension. Not sorry. This is extension, not flexion. Flexion. Flexion for you will have to hamstring muscle, gastrocnemius muscle, sartorius, gracialis. Hamstring already we studied gastrocnemius and sartorius and gracialis. And third is medial rotation. Medial rotation, you have semitendinosus, okay, semimembranous, gracialis, and sartorius. Already you studied. And fourth one is lateral rotation. We have one muscle, that is biceps femoris. Biceps femoris is responsible for lateral rotation. So all these are functions or movements of the knee joint. Now we have uh, clinical anatomy. What are the conditions arises in this particular areas? First is you will able to see effusion. Effusion means fluid accumulation at the knee joint. Effusion you will able to see first condition. Effusion, okay. Fluid accumulation in the knee joint, first condition. Clinical anatomy. Injury to the cruciate ligament. This will occur when you fell down. Any occurs. Injuries to meniscus, injury to the ligaments, okay. Injury or inflammation of bursa, inflammation of bursa, and inflammation of bursa, all the are or dearticulation of decreased synovial fluid or articular cartilage degeneration. We will call osteoarthritis, articular cartilage or fibrous cartilage degeneration. So these are all seen in the knee joint. Okay. So this is very, very important. So a completed knee joint anatomy, structure, movements, nerve supply, blood supply, and clinical aspect. Okay. So thank you. Thank you very much. In next class, we'll discuss about ankle joint.